community-based solutions. And with that, I'd like to welcome the Minister of Health, the Honourable Sylvia Jones. Thank you so much for coming today.
Well, thank you so much, John, and good afternoon, everyone. It is indeed great to be back in the Hamilton region at St. Joe's Villa in Dundas. It's also great to see the teams that have joined us here from St. John's Villa, St. Joe's Healthcare Hamilton, and of course, Hamilton Health Sciences, who all go above and beyond each and every day to provide exceptional care for people and families. Today is an exciting day as we celebrate another milestone in the Hamilton region, the groundbreaking of the new reactivation center here at St. Joseph's Villa. Congratulations. On behalf of Premier Ford and our entire government, I want to thank you for hosting us today and for all the work we have done together to make today's announcement a reality. Under the leadership of Premier Ford, our government has been making record investments in healthcare. Through our Your Health plan, we are taking bold action and making innovative changes to build a healthcare system that lasts for decades, a system that makes it easier for you and your family at every stage of life to connect to the right care in the right place. Each time I visit Hamilton, it's to celebrate an exciting accomplishment in building a stronger, more connected healthcare system throughout your region. Over the last year, our government has announced the largest investment in McMaster Children's Hospital's history, connecting an additional 4,000 pediatric patients to care through outpatient clinics and increasing pediatric surgery by over 27% in less than a year, completely transforming the way pediatric care is assessed and experienced by children and their families in the Hamilton region. We have also celebrated the opening of the Centre for Integrated and Advanced Medical Imaging, a new MRI facility for educational training and imaging research located at the Mohawk McMaster's Institute for Applied Health Sciences in partnership with Hamilton Health Sciences and St. Joe's Healthcare in Hamilton. The second of its kind in Canada, the centre takes an integrated, innovative approach in performing twice the number of MRIs per hour, making it faster and easier for people to access diagnostic imaging in your community. And this morning, our government announced 14,000 more people throughout the Hamilton region will be connecting to primary care through expanded mobile outreach teams, the creation of a new location for a family health team, and the expansion of existing Indigenous-led community health centres. They're just some of the many ways our government is getting it done in Hamilton. Today, we continue to build on the progress to build a more connected and convenient healthcare system across Hamilton, breaking new ground on the new Reactivation Care Centre. Supported by our government's $16.7 million investment, the new 57-bed facility will provide restorative and specialty care and support to people transitioning from a hospital to a setting that best meets their needs, whether that be care in their own home or at a long-term care facility. 3 new care units will deliver dementia care, behavioral support services, hemodialysis treatment, and support those with complex care needs. Expanding services to connect people who no longer require hospital care with the restorative and specialty care they need will also work to expand capacity at our hospitals, freeing up additional beds and reducing wait times for key services such as surgeries, to further expand hospital capacity in the Hamilton region now and for decades to come. Our government is getting shovels in the ground for the St. Joseph's Healthcare Hamilton Psychiatric Emergency Services redevelopment, Hamilton General Hospital's Emergency Department expansion, and the West Lincoln Memorial Hospital redevelopment. These projects are just a few of our government's over 50 hospital developments across Ontario that will add 3,000 new hospital beds over the next decade. Today's exciting announcement, breaking ground on the new Reactivation Care Centre at St. Joseph's Villa, is another way our government is ensuring patients receive timely and appropriate care in their community. Our government will continue to work collaboratively with all of our healthcare and community partners, including many of you who are here today, to build a stronger healthcare system now and for years to come. Thank you for everyone again for joining us today. I hope the next time we meet in this space, it will look a little different. I know this is one of your many milestones on the journey to opening your doors, and I look forward to watching your progress. I'd now like to turn it over to Mike Keenan, President of St. Joe's Healthcare Hamilton. Thank you, and stay well.
Thank you, Minister. I promise you the ceiling fan will be a little better. Good morning. I'm Mike Keenan. I'm the President of St. Joe's Healthcare in Hamilton. I want to say thank you to everyone joining us today, and to you, Minister Jones, for this important investment in our community and all the accomplishments that you've also outlined today for our city. We're so grateful this government recognized the need to create more care options for people to recover while increasing much-needed capacity in our hospitals. Today we're marking the start of the construction on this new reactivation care center that'll provide up to 57 new beds. Maybe I should have said 75. Would be that okay, Minister? Who no longer need care in a hospital setting, that are sitting in an acute care bed that can come here and get the appropriate care at the right place at the right time. And so their recovery will have the appropriate tailored support so they can return home to a long-term care facility or other community supports that the Ontario health system provides. With the immense pressure facing our healthcare system, adding this new reactivation care centre to our continuum of care will free up much-needed beds in both Hamilton hospital systems and allow us to treat more patients faster. It is an excellent example of how the Hamilton healthcare community, in partnership with the provincial government, comes together to develop innovative models of care that increase capacity in our hospitals, while continuing to provide high-quality care for our patients. This project in particular is a collaboration between the province of St. Joe's and our partners at Hamilton Health Sciences, and one that we're proud to be a part of. That is why I am so glad to be also joined by Tracy MacArthur, our President and CEO at Hamilton Health Sciences. Over the past several months, as Tracy and I assumed our leadership responsibilities, we've been working closely with the City of Hamilton and McMaster University's Faculty of Health Sciences to build a renewed, strong relationship that illustrates how hospitals collaborate across the city to deliver exceptional care no matter where you live. At St. Joe's, our mission is deeply rooted in the values of the Sisters of St. Joseph's, to serve with compassion and uphold the dignity of every single person. This new space will allow us to do just that with our partners at Hamilton Health Sciences and St. Joseph's Villa. We will continue to innovate and advocate for our community needs and to work with our partners to deliver the best possible care. So with that in mind, a final thank you again to Minister Jones and Premier Ford and the provincial government for joining us today. I'm going to hand it over to my colleague Tracy to bring greetings on behalf of Hamilton Health Sciences.
Thank you so much, Mike, and thank you for extending such a warm welcome to me as I join this community, and for extending partnership to Hamilton Health Science. I'm Tracy MacArthur. I'm President and CEO of Hamilton Health Sciences, and I'm very honored to be here today, joining our partners at St. Joseph's Healthcare Hamilton, St. Joseph's Villa, as well as our government, in a space that we all know will soon be transformed to better serve our community. Really wanted to thank Minister Jones for her presence here today and for your announcement. We extend our very sincere thanks to the Government of Ontario for its investment in the Reactivation Care Centre in the Hamilton region. Hamilton Health Sciences is very proud to be a partner in this vital initiative as we move forward in our own mission, which is to provide best care for all. The Reactivation Care Centre is a strategic investment. It's innovative, it's collaborative, and it's designed to address a critical need in our community. And as my colleagues have mentioned, healthcare is certainly not one size fits all. Across our community, there are many individuals who require care, but no longer require care in a traditional hospital settings. These are patients who need a very safe and supportive environment as they transition from hospital to home or to community-based care. So really, this innovative solution in maximizing the unoccupied space at St. Joseph's Villa allows us to optimize our healthcare resources and create an ideal environment for specialized care. And as we've talked about, this care includes convalescent care, that's individuals post-surgery or requiring additional care before returning to their community, neurocognitive and behavioral support, this includes specialized dementia care, as well as medically complex services that will be able to be supported here, including dialysis, wound care, and specialized bariatric care. So this innovative model is really an exemplary example of how healthcare providers must collaborate to provide better care for all for the patients that they serve within their community. Thank you all for this wonderful partnership. Again, I'd like to thank St. Joseph's Healthcare Hamilton, St. Joseph's Villa, Mike Keenan, John Woods, our partners who provided our tour today, our board chair at St. Joseph's Hamilton, Barb. Really, your commitment to this initiative provides more options and access for patients in our own community and allows our hospitals to deliver new models of care to best serve our patients' needs. And thank you again, Minister Jones. So I believe that concludes our formal remarks, and now we will be having questions, and I will pass it on to our colleague.
We will now take questions from the media. As a friendly reminder, the format is one question, one follow-up. Please state your name and your outlet before your question. First question.
Hi, I'm Mira Medjugorje from Radio Canada. Minister Jones, I wanted to talk to you about measles. We've had 24 cases this year. We haven't had that many in a single year in the past decade. Back to school is coming up. What is the province doing exactly to get immunization rates back up and more generally to address the problem?
Thank you for the question. So well over a year ago, we transitioned and worked very closely with the Chief Medical Officer of Health to direct the public health units, the local public health units, to refocus their efforts on catch-up on childhood vaccines. That effort has been going on for, as I said, well over a year, and I would just encourage people to have those conversations with their primary care practitioners to make sure that their vaccines are up to date, including ones that directly impact children and our school system such as measles. But all of the whole suite of childhood vaccines, there has been a focus at the local public health units to refocus their efforts to make sure that those catch-ups occurred.
And as a follow-up, if you could react to this new study that was released today, peer-reviewed study that shows there's very important mental health and morale strain on healthcare workers in Ontario across the provinces, and the study's authors say that this puts them at risk of leaving the job in massive numbers. So if you can react to that and so what's being done to address this issue.
Yeah, again, really important to highlight that without a doubt, the pandemic and the impacts, particularly on our healthcare workers, are real and need to be addressed. We have ensured by working with our hospital partners, making sure that they have access to the services that they need. I know personally there are a number of hospital organizations that have refocused their efforts to make sure that as their staff, as their team members, as their clinicians continue to deal with a very changing, fast environment in our healthcare system, that they have the supports they need. So a number of organizations have additional resources and programs in place specifically to ensure that their healthcare staff, when they need help and even proactively, have the resources in their own systems. And that's been ongoing. I visited one almost a year ago.
Julie Sharp, CHCH News. How will today's announcement make sure a case like Len King, who was a Brantford man who passed away after waiting 33 hours in emergency for care, doesn't happen again?
Yeah, very disturbing story, and I think it just speaks to the investments that our government continues to make. You know, this is an example of a expansion that can happen relatively quickly. We, of course, have new hospital builds that we are also doing, South Niagara being a really important one to build capacity in the Niagara region. I think it just speaks to the needs that continue to impact our community and why investments, why building beds, by expanding facilities, we're actually making an impact on people's lives. And I don't think anyone wants to see what happened to Mr. King happen in any other facility.
Thank you. And the follow-up, what's the timeline for this specific project?
Oh, Mika, John, do you want to speak to that? I know it's faster than a normal build.
Spring of 2026.
Spring of 2026.
That concludes our media availability. Thank you everyone for attending.
Great. Thank you, Minister.
Thank you, Minister.